Hello, good evening. Who am I talking, please?
Good evening. Miko si Faith ni.
Oh, okay, gusto.
Kanang na ako igsoon ba na siya sakit nga bipolar. Gusto lang unta ko makabalo kung unsa ang mga causes aning sakita.
Bipolar is a disorder in the brain. Factors that may increase the risk of developing bipolar disorder or act as a trigger for the first episode includes, first is having a first-degree relative such as parent or siblings with a bipolar disorder. So, do you recall any of your relatives na may bipolar disorder?
Kato akong lolo sa una. Huwag ko na yung nakuan.
Maybe sa take na sa genetics na pasapasa nang na siya inana karon. Isa po ng factors high stress such as death of a loved one or traumatic event. Do you recall any event in his life that hindi na trauma siya?
Wala man pod.
Drug or alcohol abuse.
Awo, usog mo to siya mo inom.
Wala pa sila yung bisyo.
Maligarilyo.
Maybe maampo na isa po na sa mga factor. Ang bipolar, if left untreated, can result into serious problem that affect every area of your life. Maybe suicidal attempts, poor work or school performance. If poor yung work performance, maybe problema sa financial problems, and also damage in relationship because of his mood swings. Kalit na siya kasuko, kalit na siya og kalipay. And maautotanan ang mga cause sa bipolar disorder.
Mao ba, Doc? Sige, salamat kay nakabalo na jud ko kung unsay mga causes aning sakitang bipolar.
Sure, Faith.
All types of bipolar disorder are characterized by episodes of extreme mood. The highs are known as manic episodes and the lows are known as depressive episodes.
Bipolar 1 disorder is also known as manic depressive disorder or manic depression. A person affected by bipolar 1 disorder has at least one manic episode in their life. A manic episode is a period of abnormally elevated or irritable mood and high energy, accompanied by abnormal behavior that disrupts life. Bipolar 2 is similar to bipolar 1 disorder, with mood cycling between high and low over time. However, in bipolar 2 disorder, the up moods never reach full-blown mania. The less intense elevated moods in bipolar 2 disorder are called hypomanic episodes or hypomania. A person affected by bipolar 2 disorder has at least one hypomanic episode in their life.
Ako? Okay na magigay ko? Oh, yeah, I'm great. But, magdula may isa akong mga amiga. Ganoon, di ko na. Pero atong nagyan daw. Gusto kong atong Mount Fuji. Pero wala ko na ito. Ang gidala ko sa kong superpowers dito sa Mount Everest. Di ka kainin. Na. Saan pili akong mama? Di ko kapalitan ang tarong na lang. Puro na junk. Bakit? Okay. Thank you. Cyclothymia or cyclothemic disorder is a rare mood disorder. Cyclothymia causes emotional ups and downs, but they're not as extreme as those in bipolar 1 or 2 disorder. Cyclothymia symptoms alternate between emotional highs and lows. The highs of cyclothymia include symptoms of an elevated mood or hypomanic symptoms. The lows consist of mild or moderate depressive symptoms.
Feeling na ko worthless, hopeless.
Giti kay ko pero eh. Sige kuso kong anak. Hopeless nagkikaya akong pamati. Hindi ko ganahan matulog o di ko katulog yun. Okay, sige ra ko muna sa akong problema. Naisahay nga, gusto na lang nako nga mamatay na lang ko.
Includes a combination of medication and also talk therapy. So these are the medications that are used to treat the disorder. We have the mood stabilizers, which includes the lithium. It has been used since the 1970s to control symptoms of acute mania and prevent recurrence periods of mania and depression. We also have the anticonvulsants, which is also a mood stabilizers that has been used since the mid-1990s. These drugs include the valproic sodium, the matrogen, and the valproic acid. We also have the antipsychotics. So if symptoms of depression or mania persist in spite of treatment with other medications, the antipsychotics may help. This includes olanzapine, acenadine, lurasidone, and risperidone. We also have the antidepressants, which includes the SSRIs, or the serotonin reuptake inhibitors, the SNRIs, or the serotonin norepinephrine reuptake inhibitors, the MAOIs, the monoamine oxidase inhibitors, and the tricyclics. They manages depression and also triggers manic episodes so that they are prescribed with a mood stabilizer or antipsychotic. We also have the anti-anxiety, which includes benzodiazepines to help anxiety and improve sleep, and antidepressant antipsychotic. Medication Simbax combines the drugs fluoxetine and olanzapine as a treatment for depression and a mood stabilizer. That is the medical management of bipolar disorder.
Nursing management for bipolar disorder includes number 1 is history. So history, taking a history with the client in a manic phase often proves difficult. Obtaining data in several short sessions, as well as talking to family members, may be necessary. Then second is general appearance and motor behavior. So client with mania experience psychomotor agitation and seem to be in perpetual motion. Sitting still is difficult. This continual movement has many ramifications. So client has been exhausted or injured themselves. Next is mood and affect. Mania is reflected in periods of euphoria, exuberant activity, grandiosity, and false sense of well-being. Thought and process content. Cognitive ability or thinking is confused and jumbled, with thoughts racing one after another, which is often referred to a flight of ideas. Clients cannot connect concepts, and they jump from one object to one another.
Another nursing management for bipolar disorder clients are
Our first is providing for safety. Primary nursing responsibility is to provide a safe environment for client and others. For clients to feel out of control, the nurse must establish external controls empathically and non-judgmentally. And the next is meeting physiologic needs. Decreasing environmental stimulation may assist client to relax. The nurse must provide a quiet environment without noise, television, and other distractions. Finger foods or things client can eat while moving around are the best options to improve nutrition. Next is providing a therapeutic communication. Clients with mania have short attention spans, so the nurse uses simple, clear sentences when communicating. They may not be able to handle a lot of information at once, so the nurse breaks information into many small segments. And then next is you have to promoting appropriate behavior. The nurse can direct their need for movement into socially acceptable large motor activities such as arranging chairs for a community meeting or walking. And then lastly is managing medications. Periodic serum lithium levels are used to monitor the client's safety and to ensure that the dose given has increased the serum lithium level to a treatment level or reduced it to a maintenance level.
Successful treatment of bipolar disorder depends on a combination of factors. Medication alone is not enough. In order to get the most out of treatment, it is important to educate yourself about the illness, communicate with your doctors and therapists, have a strong support system, and help yourself by making healthy lifestyle choices that may reduce your need for medication. Common bipolar treatments include mood stabilizers. These amply named meds help even out the swings, lessening the chances of high highs and low lows. Another are psychotics. These faster-acting drugs begin easing symptoms within a few hours, so they can have your back while mood stabilizers are doing their slow and steady thing. Another is ECT. When medication just isn't working well, electroconvulsive therapy can be a good option for people with bipolar. It is even safe to do during pregnancy. Talk therapy, working with a therapist, helps you better understand your emotions while learning important strategies to help you cope with your condition. Another is you need to recognize that there's a difference between your symptoms and your real self. By understanding how bipolar disorder affects your behavior, you can separate the symptoms of your illness from your character. Another is you need to educate your loved ones about bipolar disorder. The more your family and close friends know, the better they can help you cope with the symptoms, spot triggers, and handle any crisis. Another is you need to make healthy lifestyle choices. Recovery is also about creating a healthy lifestyle, which includes staying physically and socially active, getting regular sleep, eating to promote brain health, and avoiding alcohol, drugs, and risky behaviors. Lastly, find the treatment that works best for you. Talk to your healthcare provider about your medication's effects on you, especially any unpleasant side effects. There are many options for you to try, but it is very imperative that you talk to your healthcare provider first before making any changes to your medication. Recovering from bipolar disorder doesn't happen overnight. As with the mood swings of bipolar disorder, treatment has its own ups and downs. Finding the right treatment takes time and setbacks happen. But with careful management and a commitment to getting better, you can get your symptoms under control and live life to the fullest.